about almost 109,000 physicians leaving private practice. This trend occurred between the years of 2019 and 2021, which highlights a significant shift in the healthcare landscape. For optometrists, obviously, this trend mirrors what many are experiencing: the growing appeal of employment over independent practice, the administrative burdens that we see, financial uncertainty that we've seen over the last 4 or 5 years, and the operational challenges of running a private practice lead many optometrists to consider employment with larger health systems or corporate entities. And this shift has broad implications, in my opinion, including changes in patient care models and the potential loss of autonomy for practitioners. And that kind of underscores the experience I had with this other provider. Hello and welcome to the Critical Podcast on iCode Media. Today, I wanted to discuss some numbers that I had run across. Recently, I had a few patients referred to me from another provider in our area, in our community, that was referred for services that I know the other referring provider used to provide. And now they've been gobbled up by private equity. And it just sort of was a stark reminder of the things we hear happen occasionally with private equity and with purchases of practices does actually impact patient care. This patient had to drive a long way to see me, where before that provider would have been right in their backyard, and now no longer, when asked, provides the care that they had the knowledge, education, training, and years to provide. So I want to dive into some of those numbers as it left me kind of looking at numbers as why we are doing the things we're doing and what impact it has on patients. I want to talk about some of that stuff today. So please enjoy this monologue. As always, be sure to subscribe to the podcast, write a review, share it with your friends, and support those who support us. The most common questions I get include, what ophthalmological codes or evaluation and management codes should I use? What ICD-10 codes do I need to bill with this CPT code? What CPT codes can be billed together and what can't? And my favorite, how do I manage a patient who has diabetes who comes in for a quote-unquote routine eye exam? These questions really highlight the confusion and uncertainty that serves as a daunting hurdle for providers, makes it more challenging for them to care for their patients and provide those patients with the best opportunity for a lifetime of ocular health and clear vision. That's why we built iCode Education, for this specific purpose. Our mission is to provide optometrists with resources to help you understand disease states, revenue cycles, and billing and coding so that you can put that on autopilot and truly care for your patients. Check out eyecodeeducation.com. That's EYECODE education.com. We've developed a premier billing and coding bundle that includes all of our billing and coding resources in one place. We also have a 10% discount code just for listeners of this podcast. Enter the coupon code EYECODEMEDIA22 at checkout. We'd love to work with you. Check out eyecodeeducation.com. Hello, dedicated optometrists. Are you looking for a way to support your patient's vision and overall eye health? Let me introduce you to Vision Edge Pro, a visual performance supplement that stands out in our profession. Vision Edge Pro contains a balanced blend of mesozeaxanthine, lutein, and zeaxanthine in a 10-10-2 ratio. This combination has been scientifically shown to increase macular pigment density, which enhances visual performance, including contrast sensitivity and vision in glare situations. Additionally, Vision Edge Pro provides 300 milligrams of DHA and EPA, fulfilling the daily requirements for omega-3s as recognized by the leading health organizations. This ensures your patients receive the essential nutrients their eyes need for optimal health. Whether it's for everyday screen use, night driving, or enjoying the outdoors, Vision Edge Pro supports your patients in seeing their best. Recommend Vision Edge Pro for your patients today and help them achieve clearer, healthier vision. Contact your local MacuHealth representative for more details. Vision Edge Pro, because your patients deserve the best in eye health. Go to MacuHealth.com and use the coupon code PODCAST2024 at checkout for special discounts. So let's dive into some of the numbers that I was able to come across. So, really what I was trying to answer is what's going on in the healthcare space in general, and then how does it apply to optometry specifically? So a lot of these numbers are just general, apply to all physicians. but obviously we can gain information. And so let's dive into how these numbers paint a picture of the evolving landscape in the healthcare industry, particularly focusing on our profession, on optometric profession, and the potential implications that this holds for our patients and for our practices. So first, 108,000 about almost 109,000 physicians leaving private practice. This trend occurred between the years of 2019 and 2021, which highlights a significant shift in the healthcare landscape. For optometrists, obviously, this trend mirrors what many are experiencing: the growing appeal of employment over independent practice, the administrative burdens that we see, financial uncertainty that we've seen over the last 4 or 5 years, and the operational challenges of running a private practice lead many optometrists to consider employment with larger health systems or corporate entities. And this shift has broad implications, in my opinion, including changes in patient care models and the potential loss of autonomy for practitioners. And that kind of underscores the experience I had with this other provider. It also means that patients receive less personalized care. One of the very interesting things that I've seen in the private equity landscape in optometry and ophthalmology is, again, the idea that doctors are interchangeable. So in our community, we have a few large groups with multiple locations, and each physician, both optometrists and ophthalmologists, rather than focusing in one of those locations and really serving the patients in that one location and developing this longevity of doctor-patient relationship, they'll spend a day a week at each location. So the doctor sort of rotates around, not because they're super specialized in one area, but because in my opinion, it makes them less likely to build relationships with their patients over time. So in my view, that's why that protects that business. The business does that. So if one doctor gets fed up with that process, when they leave, the loss to that individual practice, that individual location, is only about 20%, right? If they're seeing patients 5 days a week and that doctor's only there one time, patients can kind of easily swap over to another doctor. A newer doctor can be interchanged and plugged in, and the business doesn't really suffer. Whereas, in a comprehensive primary care independent practice, you invest a lot of my time as the owner, or any new associate that maybe at future become an owner. You're investing a lot of time and resources in that new doctor, and they're going to build and grow. And if that doctor leaves, it's a huge debt to the practice if they've already got a large patient base. So this protects those private equity firms. It's a smart business move. It's not the best move for patient care, in my opinion. So again, what happens? Well, if you look, again, on the horizon, there's a proposed 2.8% reduction in the conversion factor for the 2025 CMS physician fee schedule. And that has significant implications for all physicians, including optometrists. And this reduction means decreased reimbursements, obviously, for our services rendered to Medicare patients. But while 2.8% might not seem substantial at first glance, it compounds with other financial pressures, which we're going to talk about in a second, which leads to tighter margins. And so optometric practices, particularly those heavily reliant on Medicare or other managed care situations, will need to reconsider those financial strategies, possibly cutting costs or finding new revenue streams to maintain that profitability. What are the options? Obviously, we can see more patients, we can sell more widgets or sell more expensive widgets, or we can provide more services. So those are kind of our options. I mean, obviously, people get fed up and they wind up dropping plans. That's another option as well. But, Medicare kind of sets the tone for what happens across the payers, across, all other payers. And, a lot of other payers link their payments to that physician fee schedule. So when Medicare declines, you might see other private payers decline as well. One of the other interesting things that I think about is the totality of those declining reimbursements over time. So I want to dive into that number as well. So if you look at go back, so I like to go back to 2008, but because that's when I started practicing. But if you go all the way back to 2001, there's a 29% decline in Medicare physician payments since 2001. Not kind of outpacing inflation by less, but it's actually a decline by almost 30% in Medicare physician payment, which when you adjust for inflation, obviously underscores a long-term erosion of the compensation for services provided to Medicare beneficiaries. So for optometrists, this decline means that while the costs of running a practice obviously have steadily increased, and I'm going to talk about that in a second, the real value of Medicare payments has diminished significantly. And this financial squeeze obviously leads to reduced investment in technology or staff or patient care, or certainly can, and ultimately it can impact the quality of care that patients receive, and so and drive providers out of the practice. The other thing, when I think about it, is when you look up U.S. inflation rates, you'll find that since 2001, the inflation has driven up the cost, obviously, across the board by almost 78%. So while our reimbursements have declined almost 30%, our costs have increased by almost 78%. That's just across the board. I'm going to get into just kind of surgical and medical supply costs in just a second, which are even more staggering and even more short term. But obviously, this inflation means that the Medicare reimbursement deflating while the cost of doing business is inflating. It also means that when you ask for a raise for managed vision care plans, I mean, think about this. You talk to a managed vision care plan and they've held their reimbursement stagnant. So if I go back to 2001, most managed vision care plans that exist today are paying basically 2001 levels. And while we get really frustrated with that, and certainly rightfully so, they can actually sit back and say, listen, we're paying you. We have not declined our reimbursements, but Medicare has, and you still take Medicare. So we're going to hold steady. That's a benefit. We're not giving you a raise, but we're not going to decline our payments. That's pretty staggering. And in fact, if you think about that rate of decline for Medicare, at some point, Medicare reimbursements could be worse and may be worse than your managed vision care plan, who have not increased those reimbursements in 30 years. So that declining reimbursement, take a step back and think about that. A patient with significant complex chronic conditions that is in your practice, that is at the age of having more than one, at least one, but likely more than one complex chronic disease, now at some point might be your evaluation of that patient might be reimbursed at a lower rate than your managed vision care plan. I mean, it's staggering. And so then you get into the idea of, well, how do we manage all these chronic conditions? Do you actually parse down to saying, look, I'm only going to manage one chronic condition at one specific visit? We might need to head that way in some way in order to basically satisfy the ability to continue to see patients. If we look at just the medical and surgical supply costs, so forget about 2001 and increasing inflation since 2001, but there's been an 82% increase in medical and surgical supply costs per full-time physician between 2022 and 2023, which is obviously just a stark reminder of those rising costs of practice. And so obviously for us, these increased costs can eat into our already thin profit margins, especially when you combine it with the other stagnant or declining reimbursement rates. So again, we have to absorb those costs or cut back on expenses or figure out ways to pass those costs on to patients. All of those things have a significant implication for the sustainability of practices and accessibility of care. So if you're not consciously thinking about this and thinking about how to adjust for that in your practice on a regular basis, you're going to be very far behind. So other reasons outside of costs, right? Other reasons that might play a role that we've seen in the marketplace that are numbers that I think are pretty staggering. We talk about Stark Law, and there's been a lot of to do in billing and coding circles about Stark Law and basically kickbacks for co-management. And so there was just in 2023, there was a $12.6 million Stark Law settlement, obviously, which is compliance and regulatory enforcement, mainly from making sure that if you're co-managing specialty implants, you do it the right way. Joe Deloche has talked about that on this podcast. Aaron Warner have talked about that on this podcast channel. I've discussed it on the podcast channel. Just make sure you're doing it the right way. There's easy ways to do it. Make sure that you and your the surgeon that you're using are on the same page. Obviously that's significant. And so that one settlement, what does it do to the psychology of the profession? Well, it just means like if I run a practice it's just another thing that I look at and I say, oh man, that would really stink if this occurred to me. So maybe I'll just offload that risk to some other big entity that wants to manage that risk, and I'll just see patients, and I'll just make money, seeing the patients that I'm seeing in my practice as opposed to owning the business. Another number, which, I think this is high for optometrists, but if you look at the risk of malpractice lawsuits, over all physicians, 1 in 3 physicians will be sued for medical malpractice during their careers. So obviously, this is a reminder of those legal risks inherent in healthcare. When you own a practice that becomes even, more substantial, obviously it increases our anxiety. It increases our defensive approach to the things that we do. That leads to, higher malpractice insurance premiums. So far, optometrists, generally speaking, are less likely to be sued than other physicians. So our malpractice insurance is relatively low, but again, it leads to uncertainty. It leads to more anxiety. So, my recommendation from that, my take home from that is make sure your documentation is locked down. When there's uncertainties that exist, you document that appropriately. You're providing clear communication to your patients. And then, most importantly, you're looking at our clinical practice guidelines and our preferred practice patterns to know what are those best practices that we need to follow to mitigate the risk of litigation. And then, one of the other things that will help with that is obviously if you know what your clinical practice guidelines are and you're adhering to them, you will follow these patients that we're talking about. You'll follow them more closely over time. You'll develop better relationships with those patients over time. And actually that'll generate more revenue. That's what we talk about all the time in Comprehensive Optometry Simplified for our subscribers is how do you make sure that you're doing what's best for the patient? Ultimately, it will do what's best for the practice if you follow those guidelines and you document appropriately. So, why are people leaving their practice outside of those sort of main things? Obviously, we've talked about, malpractice. We've talked about costs. We've talked about declining reimbursements. We've talked about settlements. But, what do doctors, when they think they're going to sell their practice, what do they think they're going to gain out of it? Why do they think that another bigger entity is going to be able to do better than they are? Well, when surveyed, physicians cite the need for better leveraging in payer negotiations. So we feel sort of, as optometrists and other physicians feel the same way, is that we feel like we don't have any way to actually go out and negotiate with a payer. We don't have any leverage with them because we're just an N of one in a community likely that has a lot of other options. And so because of this, we can't really go in and negotiate very easily. And so they can continue to decline reimbursements while charging more for the insurance that they're selling to the general public. And so obviously this desire for better leverage in these negotiations highlights the difficulties that many of us face in securing compensations that we believe are fair for the services that we're providing. Selling to a larger entity might offer immediate financial relief, right? So one, we get a large lump sum of money that is rewarding for selling our practices, but obviously we have more negotiating power if we're around with a bigger conglomerate. CooperVision and the AOA have joined forces in a groundbreaking initiative to transform how optometrists treat children with myopia. The Myopia Collective aims to unite our profession and its allies to challenge the status quo and elevate the standard of care for children with myopia. Everyone is invited to become a member of the collective. By joining, you pledge to act in slowing childhood myopia progression. Membership includes regular updates and information about the collective's efforts, access to educational opportunities and resources, and insights from the ambassador optometrists who advocate for community policy and changes supporting the collective's mission. Click the link in the show notes to join the collective today. We've been partnering with EssilorLuxottica 360 for a while now, and it helps us in 3 areas. First, they use social media campaigns to highlight products that we believe in and prescribe to our patients, and they deliver those patients back to our practice. Second, EssilorLuxottica 360 enhances our patient experience through staff training tools that help us simplify and streamline the way we communicate about our products and services. Lastly, but for my practice most importantly, it helps us make good business decisions related to our optical offerings. We will systematically and objectively analyze what our patients are purchasing and what they like, and removing products that our patients are not really using or not really drawn to. This, along with additional rebates and immediate savings, helps us continue to deliver high-quality products and services to our patients and keeps our practice resilient. Check out EssilorLuxottica 360 for yourself by visiting EssilorLuxottica360.com. The other thing, when we think about where those practices are selling, if you think about like hospital systems or other physicians, larger physician groups, when a physician practice sells, 63% of the time across all practices are being sold to private equity firms. So this reflects obviously this increasing influence of private equity in healthcare, not just for optometrists, but for other physicians. And this trend obviously raises concerns about the future of patient care and practice management. Private equity firms typically focus on maximizing financial returns. It's a really good, thing for them to do as a business. Optometrists generally obviously have a lot of good business savvy, but we may not look at our practices and the services that we're providing as business ventures first, which I think is good. Obviously, we want to look at our patient care first, but we really need to be aware of the fact that patient care does have to support a business. And so obviously when private equity comes in, you hear about cost-cutting measures that can impact the quality of care. They can also consolidate, which gives patients less options over time. And then obviously eliminate services that they don't feel are revenue generating or as revenue generating, just like the first story that I shared with you all when I came on today. 77% of all physicians are now employed by hospitals, health systems, or corporations like private equity, further emphasize that movement away from private practice. So again, people are selling to private equity, but they're also leaving their practices and moving into larger healthcare systems. So for our profession, obviously, what is the future of independent optometry? I actually think in all of these stats, I'll kind of summarize, but I think that there's still a lot of opportunity for us. When we are absorbed into larger entities, there is risk of standardization of care. There's less emphasis on personalized patient-centered care. It also impacts our decision-making, right? So employed optometrists may have less control over their practice environment or the type of patient interactions that occur, and that's downward pressure. And so obviously for those of us in independent practice and private practice, we need to be aware of those types of pressures so that we can build systems in our practice that resist those pressures. So how do we serve our patients when it's hard to find new employees and support staff? It's not just optometry that has a hard time finding support staff. The dentist down the street is looking for the same support staff. The orthodontist down the street, the internal medicine doctor down the street is looking for those same people to answer phone calls and triage patients and be the receptionist and be the technician. In all those cases, we're competing with them. We're not just competing with other optometrists. And then, so I think the dynamics of these numbers are really interesting to me. Optometrists in independent practice should be able to clearly state our intentions for impacting their community, both by delivering eye care services, but also giving back. I mean, I think one of the things that's important within my practice is how do I tell the story of what we're trying to do in our community. Yes, obviously, we want patients to see well for a lifetime. We want to serve those patients in our community. But we also want to serve our community. We want to hire more people. When I look to hire new people, I don't look first to hire people who are remote. We do have remote workers in our practice. But that's not, we did that out of necessity. We did that out of trying to find new people to come work for us, increasing our rates of payment, increasing our benefits, reducing our work schedules. So we can squish a work schedule down into 4 days a week so people can get 3-day weekends in our practice. I mean, these are things that we've actively worked to do. And when we're looking for new people to bring on, it's really hard. It's really, really hard. And I know that many of you find the same thing in your area, to bring new physical people into the practice who want to actually help and serve people face to face. So we've got to tell that story. What are we trying to do? How are we changing our communities? How do we want to give back to the communities? We've been we've just got ground moving right now at our new location. So as we're building, as we've been promoting that new location and we're building it so that patients know that at some point when in the future, in the next year or so, we're going to be seeing them in a new physical plant. I'm not opening a second location. We're just moving our existing location to someplace else. And so, it was interesting. So I've got a poster that when you come in, you kind of see where it's going to be, what's the location. We put new pictures up there about what the site looks like. And so it's been kind of fun to see that as it's evolved. And we had a patient that walked out. He hadn't been in about 6 years. And my team said that he made a comment on the way out that now I know where my money's going for the expensive glasses I just purchased. And so then I felt like, well, I'm just not telling the story very well. I wasn't there to respond to him, and my staff didn't feel equipped to respond to him. But, I was interested. She did say that this patient had a managed vision care plan, and her comment to me was, well, I should have just told him that half of the money that you just spent is going to go pay the managed vision care plan and for the product that you bought. So again, we bear the brunt of that very expensive, quote unquote, expensive purchase from the patient without them being aware of the fact that we've got to pay the insurance company, the insurance that you're already paying. We're going to have to pay that insurance company back money for that. How do we tell that story better? And also, it's really interesting. We're trying to build and grow our community. We've hired, a construction company, and we've hired engineers and architects. And when you come and ask us for donations, we donate to your baseball teams and your churches. And, but that seemed to make this. Would the patient have rather? Again, I don't know what's going through their mind, and that's okay. But it's just a very interesting. Tells me I haven't told the story well. Would the patient have rather me let the practice decay? Have my dad, who owned the practice before, just sort of suck all the money out of that practice and let it decay, and then you come into a dirty, grimy place that doesn't have good technology, and we don't spend time with you because we're got to be to the next patient and to the next patient. Would you rather that, or would you rather us reinvest into the practice with new technology, make sure it's clean, it's a pleasant place to go, make sure that the new future of this practice that's going to be in our community for the rest of my lifetime, hopefully, and is it going to have a place to serve people in our community for the long term? So I don't think people really think about that, but that's not his problem. That's my problem. And we need to tell that story better. I need to be able to tell that story better. And so I think about that, and I think that's really incumbent upon us in independent practice. We can hire people. We need to inform our patients, right? We hire people. We build new locations. We support local teams and churches. We invest in other local businesses. Outside of optometry, we should be able to very clearly and proudly tell our story. And so I think the bottom line from today is I think these numbers collectively paint a picture of a rapidly changing healthcare environment. That's going to change in my practice lifetime, with significant implications for our profession. Declining reimbursement rates, rising costs, corporatization of practices, and increasing influences of private equity, we're faced with numerous challenges that require strategic thinking and adaptability. And understanding those trends and the potential impacts, it's super important for optometrists who wish to navigate this evolving landscape successfully. I think it's exciting. I think it's really exciting. I mean, it can be a downer, but I think what opportunities for those of us who can figure out this system and figure out how to thrive in this system. And there's a lot of us that will do that. So what do we do? I think, I was sitting talking to my good friend Ted McElroy and Amir Kushnevis last week. And we were having, it's been way too long since I've actually been able to sit down with other optometrists and think big about what's going on in the profession, outside of maybe a podcast conversation, but really talk about things that many people might not want to say publicly about what's going on. And when I walk away from that, I think, wow, we're still in a really great spot. But one of the things that Amir said, and I think I've been trying to find the right words for years now, is these are his words, or very close to his words, is we must be responsible for the totality of the patient in front of us. And I love that. I thought that encapsulates what we've been trying at iCode to do to help other doctors do. What I've been trying to do in my own practice is when I walk in on that patient, have the mindset that I am responsible for the totality. I'm not kind of in it for the short term. I'm not kind of want to make you happy, but I'm responsible for the totality of the patient in front of us. It means that we need to find out what's going on with them personally. We need to learn their preferences for treatment. We need to understand their risks for systemic and asymptomatic diseases that are both ocular and systemic, and have symptoms and don't have symptoms. We need to communicate that effectively in a way that's empowering to our patients to make informed decisions. Patients want this level of care. They will accept less, but they prefer that level of care. And so we have to make sure to show them that in our words, in our actions, in our language. We can't let this system beat us down. They can't beat down the doctor-patient relationship. We've got to continue to deliver value in this system and to our patients. It's critical for the eye health and vision of our patients locally and across the country. And there is nobody better to do it than optometry. So I hope this was helpful. I hope this was insightful. And I hope it encourages you to do something different in your practice next week. Maybe take a different approach to how you're going to make your patients more relaxed in your exam chair, more pleased when they come into your office, mainly so that they have a deeper trust in you. And when they seek out care, they're going to continue to seek that care from optometry. Thanks for doing everything you're doing. We'll see you guys on the next one.